This conference will now be recorded.
So my dear friend Nihal, you will present this case, and whenever you are ready, please let me know so I can start your 10 minutes, okay?
Okay. Okay. I'm ready.
Okay, Dr. Nihal, so your 10 minutes started.
Hello.
Hello.
I'm Dr. Nihal, one of Dr. Nzair Pregnancy Assessment Unit today. May I confirm your name and age, please?
Hello, doctor. This is Sarah Williams, and I am 37 years.
Yes, how are you, Sarah?
I'm not very good, doctor.
I'm so sorry for that. I understand that from your note you are pregnant. Now you are pregnant 9 weeks pregnancy and some ultrasound done for you, and now you want to review your result. Am I right?
Yes, doctor. This is because I got some spotting, some blood from down below, and then I called my GP and he arranged the scan. And my midwife told me that I have to see the doctor. Yes.
I'm so sorry for that. What going through, and this spotting when it started?
This started a few days ago. It was 1 or 2 times after, going to the toilet while whipping myself. I noticed this. So I then think that it increased yesterday. That's why I had this.
Is there any pain?
No.
I'm so sorry for that. Can I ask you some questions so I will know more about you? After that, we can discuss your plan of management.
Yeah, sure, doctor.
Okay, I understand this is your first pregnancy. Am I right?
Yes.
Can you tell me more about your pregnancy? Is it planned and continuous?
Yeah, it was planned. Me and my partner, we are together for 3 years and been trying for a baby. So finally, I got my dream came true, but now I'm a bit worried.
Okay. How about your period? Is it regular?
Yes, it used to be regular, yes.
Do you use any contraception before?
No, I told you we're trying for having a baby, so we didn't use a contraception.
Okay. Sarah, how about your cervical SB? Is it up to that normal?
My smears, yes, it was last one 3 years ago.
Do you have any medical problem?
No, I don't have.
Any surgical history in your tumor down below?
No.
Do you have allergy to any medication?
I'm sorry.
Allergies? You have
Allergy? No, I don't have allergy.
any family history of cancer?
Like what, doctor?
Like any history of clots or any chronic disease?
No, I don't have.
What do you do for living?
I am a teacher.
With whom you are living?
Living with my partner.
Is he supportive?
Yes, he is.
Sarah, do you smoke?
No, I'm not smoker.
Drinking alcohol?
No, I'm not.
Any recreational drugs?
No.
That is good. Do you know the last month do you feel low or loss of interest?
No, I was excited. Only some morning sickness that I have, and all the symptoms of that sickness and all, it went away 2 weeks ago.
Okay, so now thank you for sharing this information. Coming to your results, that this is your scan in front of me. This is your name and NHS number. The ultrasound shows that there is a sac. Now you are already 9 weeks pregnant. I'm so sorry to tell you that the ultrasound shows there is empty sac.
What are you saying? I'm
Yes.
sorry. What are you saying? What is the meaning of empty sac?
Now you are 9 weeks pregnant. It should be there is a small baby, and we should see the heart if your baby the pregnancy is intact. But I'm sorry to tell you that that means what we have would call miscarriage.
Miscarriage? Are you sure that this means I lost my baby?
I'm so sorry to be the one who delivered this news for you. As the scan shows that there is that means when the pregnancy start to grow, normal pregnancy, when the sperm and the ovum came together so as to make a baby. After 6 weeks, the baby should be appear inside the womb, and now there is only sac. That means to some reason we don't know, the pregnancy stopped growing and it only appear as empty sac. I'm so sorry for that.
This is a complete shock to me.
I know, Sarah. But we are here to support and help you. If you want me to continue to tell you what we will do next, we can continue, or I will arrange for you another
But
appointment.
how did I lose my baby? And I feel like this is only a few spotting. Maybe it's very small.
It can happen. It can happen more. Most of women they can have this miscarriage, but next pregnancy you can pregnant normal pregnancy and you can have healthy child. I'm so sorry to tell you that, Sarah. Do you want someone to be with you?
I don't know how to call my husband to tell him this news. It will come as a shock for him as well. He was waiting for that baby.
I am so sorry to tell you that, Sarah. We have a good counselor can be with you.
Okay. So what can I do now?
Can you take some tissue?
Okay, thank you. I'm fine. What shall I do now, doctor?
There is many option for that. Actually, either we have many option for your management. Either what we call conservative management. Just we will wait and see, and the nature take its course. That means the uterus your womb will start to get this pregnancy out by itself without any intervention, or we have a medical treatment. We can give you some tablet, and after that you can start to bleed and make it out, or the other option by surgical. We can empty your pregnancy by surgical method. Do you want me to talk each option for you?
No, I would prefer to wait actually.
Yes, if, your wish is totally respected. We will we will follow you, and you can come after 2 weeks, and you can come here to see us at if you have severe bleeding or pain, or you feel like high temperature, or you feel sick. We will give you our 24-hour contact number at any time. If you need to come to hospital, you can call us. We will give you information leaflet about
And
this.
how can
Yes.
I become pregnant with my
Eh,
age? I already have found difficulty of having this one, and I thought that my chances are reduced because of my age.
yes,
So
but you can. Hmm?
um, I would like to try for another baby. So
Is after this if you want to wait for this pregnancy to come out, you may have 2 to 3 weeks, and you may start have bleeding and pain, and after that we can follow you after you finish this pregnancy and you have complete miscarriage. You can get pregnant soon, maybe after 2 to 3 months. Yes, your age is 37, but it is not not too much. And I want to assure you that yes, I do agree with you. There is risk of miscarriage for with increasing age, but also you can have chance to give normal pregnancy.
okay, it's your time. Thank you.
Okay, thank you.
You're welcome. Okay, so what do you think, Dr. Nihal?
Yes. And then I think in the history, I not asking about the early pregnancy symptom. I forgot to ask.
Okay, so you already asked so many things, but this patient, she told you in between that she had the symptoms, the sickness and all, but this all finished 2 weeks ago, right?
Yes.
So this is a part of information that the patient gave you already. Okay, so anything else? Would you make it better next time, for example, or anything that came to your head in between? You think that if you
So
repeat the station, you will make it better than the previous?
the embassy and the counseling.
Okay, so what was in there? Tell me.
Need to improve.
Need to improve. Okay. Okay, so what I would say is from the clinical knowledge of view, it was an easy task, okay, and you covered the point of the management. You know, technically it's correct, but as you said, I would say something about the communication here, right? Because this case is a breaking bad news, right? So the sensitive approach and the way of the breaking bad news will be very important here. Usually, there will be a lay examiner in the breaking bad news station, and the lay examiner want to ensure that the communication is clear, and this is what they expect, okay, from you at this exam. So please try to make the breaking bad news better than this, okay? Follow the protocol of the breaking bad news. So number one, remember that you always check the patient background knowledge, okay? Background knowledge of the report, because her midwife told her that she need to discuss the report with you, right? So ask her if she had any idea about the result or the report of the scan. This is one thing. Another thing is you need to signpost all. Okay, so the signpost, you have asked her about if she needs somebody to be with her, but towards the end, okay,
Yes.
after you already have break the news. So you need to warn her, giving her the first warning, okay, shot, and then you come, you give a Okay, and in this first warning shot, you give her an idea about that, the result. Okay, if you need somebody to be with, I can see that you came here today by yourself. If you need somebody to be with you, because I'm going to discuss the news, okay, or the report with you, and there is some worrying news, okay, or some difficult news to discuss with you. So the patient will start to react, okay? So you are asking for somebody to be with her because the news is going to be not good for her. So she will start to, prepare herself. Then the second signpost that you say, I'm so sorry that the report showed that you have the baby stopped growing or the pregnancy has stopped growing. And then you just give her, okay, time to react. Some people will say count to 3, some people say count to 5. So it's according to your, station. Just give a pause, and it should be like a clear pause for the patient to absorb what have you said. Okay, and then I'm so sorry. This must be a shock for you, or came as a shock for you. Okay, would you like me to continue? Okay, yes. She will say yes, of course. Okay, so let me explain to you what it is. Finding. Okay, so explain to her the finding of the missed miscarriage. Of course, your explanation was okay. It was fine. So the missed or the silent miscarriage is one where the baby have died or not developed but has not been physically miscarried. Okay, so in many cases there had been no sign that anything was wrong. Okay, and that's why the news came as a complete shock to you. Okay, so it's normal, very natural that the patient will ask you, why did this happen? Okay, so why this has happened? This is, it's not at all clear why some miscarriage happened within days of the baby dying. Okay, or other take much longer before the pregnancy hormone level drop and physically miscarry. Okay, so what is the options? You have offered her the options, and of course, according to the NICE guideline now of the miscarriage, it's number 1 is expectant management, number 2 is the medical, number 3 is the physical. You need to ask the patient about her own preferences, okay, and if she is ready to have the news. Okay, if she is ready to discuss the treatment. So if she is ready to discuss the treatment, this is before, of course, you mention or enumerate the treatment for her. Then after you enumerate the options, you ask her if she had any specific preferences, okay, and then ask her if she would like you to explain a specific method for you or give information about all according to her, brief. She will tell you. So if she is instructed to discuss with you, for example, the conservative, she will ask you about the conservative. She's instructed to discuss the surgical, she will ask about the surgical. Or otherwise, if she is instructed to have the 3 of them information, basic information about the 3 of them, she will tell you at that time. Okay, no, I don't know, or please give me information. So you will go through the 3 types of the miscarriage, okay, and about the safety and follow-up of each one of them. Toward the end, after you finish, okay, and after you see this patient had, already the options for her, okay, so you ask her about what she wants at the moment or her concerns at the moment, okay, and provide her with a written information, and at the same time provide her with a counselor, okay, someone to speak with, someone who's trained, okay, in counseling patient after such sad event like the miscarriage, or a support group, okay, for people who have been through the same experience. So of course it is advice for a patient with this, miscarriage and this age, she is 37, okay, that she can have like a rest, as you told her this is for the physical and mental well-being, okay, and the recovery, complete recovery from 3 to 6 months, and then try another time for a baby. Very important that she have a folic acid. But here I would like to comment on your information gathering, my dear. In your information gathering, okay, because this is, well, make a bit different in the management, okay? So in your information gathering, you have asked some targeted question and you have asked some irrelevant question, okay? So please avoid completely asking irrelevant question, okay? This will irritate the examiner and this will mark you down, okay? So method of contraception is not a suitable question for this task, right? Smear history is not a suitable question for this task, right? Okay, and you asked her about the surgical history, if you have previous surgery in the tummy or from down below. What do you think the importance of asking the surgery? Why it's very important? And
If
actually,
she is option for surgical treatment.
yes, okay. And of course, if she had any problems before, maybe she had a treatment before or anything, okay. However, I would like you to avoid unnecessary question or unrelated question, okay, to the station. But in the same time, let's see what you have covered in the information gathering. So information gathering always start with the
Present complaint.
present complaint. Excellent. Okay, so the present complaint of the patient is what?
Bleeding.
And what else?
Just she told bleeding, no pain.
Okay, so the patient came with a scan, right, to discuss the report of the scan. You need to ask her first about, at introduction, how are you doing, okay, at the moment, okay, and you ask her why did she have the scan in the first, okay, occasion. Why? Because she will tell you the story. This will be like introduction to tell you the story. I have volunteered to tell you the story, but sometimes in the exam the role player is not, okay, so the role player waiting for you to ask, or ask her, would you please tell me what happened, okay. This is an open question, so you ask by the HOPI first, history of the present illness, and then you come to the open question. This is a strategy of asking. After you come to the open question, then you ask her a closed question. Closed question related to the event itself, okay. So the patient had a mild bleeding, we need, or let's say she said that she had bleeding, then we need to ensure what is the amount of the bleeding, if she buzzed any tissue, if she buzzed any clots, right, and when this bleeding started, and is it the same or changed, and if this associated with pain is associated with dizziness, right. So we just ask her these questions about the pain, okay. And what else? You ask her about medical problem, you ask her about, as you have asked already, about the surgical problem or the drug allergy and all. Have you asked this patient about her BMI?
No.
Okay, so
Blood
have you,
group.
yeah, have you asked this patient if she's aware of her blood group?
No.
Okay, so why those are important in the management of antenatal cases, early pregnancy cases? Two things. Number one, the blood group will be important if this patient choose the surgical management, right? So in this case, you will offer the anti-D for her if she is negative. This is one thing. Another thing, that if the patient has chosen the surgical management, please make sure that you ask her about the preferences for blood transfusion if need, okay? But this, I would prefer only to ask this question if the patient said that she chose the surgical management. This is one thing. Another thing, the BMI of this patient, why it's important? Simply, this is a simple advice to ask or ensure the BMI, because the patient told you that she is worried because of her age of delay conception next time, right? So you have advised her to take like a pause or a time for complete healing. Okay, and you have advised the folic acid, right? Anything else that we can advise the patient, especially if she's obese?
Reduce her weight
Yes, okay, so healthy lifestyle and reduction of weight. Okay, anything else?
and take 5 milligram folic.
Okay, any other vitamin that need to be supplied? It's a very small point.
Vitamin D.
Yes, vitamin D, excellent. Yes, okay, so for obese patient, you give the 3 advices in the antenatal: reduction of weight, healthy lifestyle, and exercise, try to reduce her weight, okay, and folic acid, okay, and this should be the proper dose, and this proper dose in the UK is only by the prescription, okay, and with the vitamin D as well to be given. Okay, dear?
Yes, thank you.
Okay, you are welcome. Okay, so thank you very much, Dr. Nihal. I think you did well. However, we need to improve our communication, okay, especially the breaking bad news strategy, and try to just filter your history taking again, okay? Okay, so Dr. Sajida is ready.
Assalamu alaikum.
Alaikum salam. Okay, Dr. Sajida, so please, this is your case. Whenever you are ready, please let me know, so I will start your 10 minutes.
Okay.
Okay, so the patient age, sorry, it's missed here. Okay. It's 16 years, okay?
Okay. Dr. Rabah, and she's 16, so she can refuse blood products, or 18
No,
is the age?
you need to explain, yes, it's 18. You need to explain to her that
Okay.
this is a life-threatening and the right, okay, for the refusal of treatment. This is the advanced directive is working from 18 years old, okay? And also you need to ensure the safeguarding of this patient, okay? And check if her family are aware or not. So for her going into emergency, that's mean when it comes to her safety, that's mean her parent need to be aware. Okay, so this is something that you need to counsel her, okay? I'm just clearing the station for you.
Yes.
Okay, so the rest is yours. The rest is your, is your task.
Okay, should I start?
Okay, 1 second. Okay, start, please.
Hello, I'm Dr. Sajda. Am I talking to Angelina John?
Yes, doctor, it's me.
What would you like me to call you?
Angelina is fine.
Okay, may I check your age, please?
It's 16 years old.
Angelina, I can please tell me how are you feeling at present? What brings you to hospital today?
Yeah, doctor, I got pain. It's a severe pain from the left side in here. And they have made a scan for me, and they told me that it's a pregnancy, but it's outside the womb. They have started a drip for me and give me a painkiller, so I'm feeling a bit better.
Okay, may I continue, or you need to wait for pain to settle?
No, it's fine. It's fine.
Okay. So, may I check, could you tell me about your pregnancy, please?
Yeah, it's. I am seeing my boyfriend for 2 years now, and usually we use a condom, but unfortunately this time the condom ruptured and I found myself pregnant.
Okay. Okay, we are here to help and support you. Please tell me, may I know what is age of your boyfriend?
He is 18 years.
Okay. And are your parents aware of your relationship and pregnancy?
No, they are not, and I want to make sure that they don't know anything about it.
Please be assured, I am not going to inform you without your consent, but I can suggest you that it is very important to inform that in such situation, condition may become condition. There could be some uncertainties in your condition, so parents would surely support you in your health stabilization and in future. I think it would be a good idea to inform you, to
Okay,
inform them.
I'll think about maybe later on.
Okay. So, could you tell me, did you use a condom for safe sex practices
Yes, yes, I told
regularly?
you we
Con
have been using it, but it was this time when it's ruptured.
Okay. And pardon asking about, have you or your partner ever suffered from sexually shared infections?
No, I don't know about it.
Okay.
I don't think so.
How have been your periods?
It was regular.
Okay. And how is your general health?
Okay, Dr. Sajda, I stop here.
Okay.
I stop here. Okay. Okay, so Dr. Sajda, we need to develop a different approach for unwell patient. Okay, so first of all, you have started well by addressing the patient by the name, confirming her age, and ensure that she is pain-free to continue the consultation, okay, and what has happened. And she told you, okay, so she volunteered that she is having a drip, okay, and now, as you can see, the patient, you know, 90 beats, this is when she's already on the fluids, okay, and there is blood pressure 100/60, so it's going to the hypotension side, right? Okay, so such patient, we don't really want to spend much time in taking history for her.
Okay.
Okay, the history should be to the target. So you have asked her about this pregnancy, okay, and then you have asked the safeguarding issue, asked about the partner, you asked about the parent if they are aware or not. Okay, so this, I think this came very early, okay, for that station. However, you could have approached it simply by saying that have you been accompanied by anybody today?
Okay.
Do you want me to call somebody to be with you? Okay, she is
Okay.
16 years old and she is in a critical situation when she is going now for operation, and you need a consent, right? So you need to ask her if she's accompanied by somebody, if she needs somebody to be with her. Do you want me to call somebody from friends or family, your parent, okay, for you? Okay, so she will come to a point that she doesn't want anybody to be with her in this situation, and she doesn't want anybody to be aware. You have to go very sensitive, okay, in the matter of that this is her views is respected, okay, and usually we would respect, okay, our patient desire or preference if they don't want to tell their parent, but since you are young, you are below the 18 years old. So it's an obligation for me, okay, that I would breach this confidentiality if you are in danger, in case if you are in danger, okay? So now you are going into an operation, right? After, of course, you ensure that she understands the situation and she understands that she needs an operation. So this patient now, she needs to go into an operation. And in this operation, this is explained to her, what is this operation? What are you going to do? What is the risk? Okay? And the need for the blood transfusion as well. So she needs somebody with her. Okay? This is a heavy counseling station, Dr. Sajda, heavy. Okay, and everything will be, you know, will matter. And don't waste time by asking about previous history of contraception. She already told you that she was using condom. Okay, it's not the time for safe sex practice. And it wouldn't make a difference for you that she had an STI now or not, right? But what make a difference for you, her general well-being now, her medical history, the background, if she had any surgeries before, okay, you need to know also about her BMI as well for the approach, and you need to discuss with her what is the diagnosis, what is the treatment, what is the risk of treatment, okay, and how serious is her condition, okay, and what you need from her. You need from her the consent for the blood group, and you need from her to inform somebody who is adult to attend with her, right? She need to be aware of all of this. Okay, so you have long time for the counseling in this station. So I would reset your time and ask you please to restart again.
Okay, thank you.
Okay, short history to the target, please, and then start the explanation and counseling.
Okay, okay. Hello, I'm Dr. Sajda. Am I talking to Angelina Johns?
Yes, doctor, it's me.
What would you like me to call you?
It's Angelina, fine.
Okay, may I check your age, please?
Yes, 16 years old.
Angelina, what brings you to emergency today? Please tell me.
Yes, doctor. I got a severe pain here in my tummy in the left side, and this is for 10 hours, and I think it gets worse. So when I came here, the doctor have seen me. They told me that I'm pregnant, but apparently this is something outside the womb. They put me on a drip, and they give me a painkiller, so the pain is much better now.
Okay. So is there any fainting episode or shoulder tip pain?
I feel some pain, yeah, maybe here on my shoulder on the left side.
Okay.
But no fainting.
Okay. Angelina, I can see you are alone. Would you like someone to be with you?
I don't want somebody to be with me. I don't want anybody to know about the situation. My friend said that this is think that this is the appendix, because I was in school today, and after that I have a tuition when I got the pain. So I just came to here, and they think that I'm having the appendix. So please don't tell them.
Angelina, I respect your concerns, but as you already understand that there is a pregnancy which is not outside the womb, and you're having severe pain, this pregnancy may end up in huge complications, some of which could be life-threatening. So it is really important that you should have some support by your side. Of course, your concern about your parental involvement are genuine, but I believe they would help and support you.
Yeah.
Moreover, yeah, please.
Yes, doctor, but I'm so worried that my dad is going to be angry at me. He doesn't know that I'm in a relationship.
Yeah, I totally understand that. But as your blood group is O negative, and it is, you understand, it is quite rare to find, and you have some reservations for blood transfusion, um, uh, uh, which can make your management little more difficult because this situation may require a blood transfusion.
Is it
And
that bad, doctor? Is it the situation is that bad? I just know that I am pregnant, and that what causing the pain for me is that that the pregnancy is not in the right, position for it. So I didn't expect that this is serious, so serious like that.
actually, I need to gather some background information, and then I'll discuss you what it is and how we are going to manage with it. So I really want that you call your parents, and or I can make an arrangement for someone to be with you. Is that okay now?
It's okay.
Okay. Are you generally fit and well, Angelina?
Yes, I am.
Have you underwent any surgery on tummy or surgery before?
Yes, I think this when I was 12, I got the appendix removed.
Okay. And how was your surgery and recovery?
It was okay.
Okay. And are you aware of your weight to height ratio?
Um, yeah, I think it's 19.
Any known allergies?
No,
And um, uh, do you smoke? Do you smoke, Angelina?
no, I'm not smoker.
Okay. Uh, alcohol or anything stronger than that?
No,
And uh, who do you live with?
I'm living with my parent at home.
Are you well supported?
Yes.
Okay, Angelina, now coming on to your management. Uh, reports indicate that the pregnancy is not within the womb. That's the right place for it to sit down. It's a look, and there is a possibility that it is outside the womb. That's the not the right place. And if pregnancy is outside the womb, it may leak. It that can lead to massive bleeding inside that tummy, and it could be life-threatening.
Okay.
So, in order to save life, uh, it may require, and you are having pain. This is an indication that it may rupture, though, and it may require a surgery. Before that, I need to run some more investigation to check your general health condition and pregnancy hormone level. That would give us more information about your internal condition, and it will help us in follow up as well. Uh, do you want are you interested in knowing your management? So now this time, your management is probably, I will involve my consultant, anesthesia specialist in your management, and your surgery, according to, yes, after investigations and your consent, and with the blood arrangements, we would like to go for a surgery that could be a keyhole surgery, and the entry point may require to be changed from belly button to another side because of your previous surgery. Uh, are you with me, Angelina?
Yeah.
Angelina, as you are less than 18, so in life-threatening situations, unfortunately, you do not have right to refuse a life-saving procedure or life-saving measures like blood transfusion. In these situations, uh, in this situation, uh, quote, in this situation, doctors may go into your best interest to stabilize your life and health.
Okay.
Am I clear,
So,
Angelina? Yes, please.
okay, so you think that I might need this?
Yeah.
Okay. Is there any other problem that can happen?
You mean any other reason for this condition? Sorry,
No,
what?
I mean any problem that can happen from the for me from
Sir,
this treatment.
surgery, please be assured, surgery would be done by suitably qualified and competent people, but still some of the risks are unavoidable. Uh, there could be some risks associated with the anesthetics and some surgical risks, like there may be increased blood loss. There could be increased blood loss, injury to organs, which may need additional procedures to repair, and a keyhole surgery may need to be changed to an open surgery, and you may require blood transfusion, admission to high dependency unit, but it is less likely. The procedure you would require is removal of pregnancy tissue. This may be by the removal of tube itself, or making a hole in the tube according to its position and size and health of the tube. Afterwards, we will. This procedure is successful in more than 97%, and afterwards we will check your pregnancy hormone level after 2 weeks to ensure it is all removed. Meanwhile, if you feel any unusual bleeding, pain, discharge, fainting episode, uh, please seek medical advice without delay. I will give you emergency contact details.
Okay.
In future. Okay,
It's
thank you.
time. Thank you very much. You feel a relief, huh? Okay, so tell me, what do you think? What's your feedback about the station, about your performance in the station?
Dr. Abba, I get very anxious. I don't know. I'm really unable to control my anxiety. I don't know. I get very anxious.
Okay, that's because of what? What is the problem with that? It's the approach, or is it the medical legal problems, or what?
I don't know. I feel I'm total flop. I think I have so many flaws which I'm unable to cover.
Okay, so I'll ask you, okay, that you reflect on your self in this task. However, this task, I think, is not very easy to approach, and you did good. Okay, so it wasn't that disaster as you think. Okay, at the beginning, maybe you missed a part of a proper explanation of the situation to the patient. Okay, and you came to the surgery as it is, already the patient is aware, or she knows that there is a surgery or something, because what's written here is that you believe that she needs a laparoscopy. So that's mean you need to discuss with her the treatment option and the situation and the laparoscopy. I felt like maybe after 3 minutes or something, you started to realize, okay, that you are going in the wrong way in the station. So you have restarted the station again, and you almost made it. Okay, so it was fine. I don't think that it was that disaster you feel. Okay, some bit of organization and some bit of confidence, okay, in yourself, and everything will be fine.
I make
Okay,
mistakes in the beginning. If I
but if you
overcome
completed the
this,
station, correctly, okay, you will take the marks. Okay, so it's not about, unless the mistake is a mistake in you know, such a big mistake. Like, for example, okay, you told this patient with severe pain that you will have option of medical management.
Mm.
Something like that will fill you the station, right? Okay, so some big mistakes that an examiner will never forgive. But in the approach of the station, if you think that you missed the point or you missed the right approach to the task, and then you have realized this and you reorganize yourself, it's fine. Okay.
I was thinking
So,
I don't have beta HCD report. How to
yes,
clearly mention? Should I
oh,
discuss differentials? Like things were crowding, and I was getting overwhelmed by
okay.
silly thoughts.
So let me go with you, okay, step by step in this station, okay. So I will start with you from the 2 minutes before the station, okay? When you come to read a station like this and you don't know what to do, okay? So you are outside the cubicle now or waiting in the online exam for the 2 minutes, okay? So you have Angelina, oh, this is 16. So Jehovah's Witness, why Jehovah's Witness is there? Always Jehovah's Witness in the exam for the blood transfusion issues and the advanced directive, okay? So the accident department will vertical spotting and severe iliac. Oh, so she had some vaginal spotting and she had severe left iliac fossa pain, okay, which had been present for the last 10 hours. Her last missed period was 7 weeks ago. Okay, so she had a missed period, she had vaginal spotting, she had severe left iliac fossa. You suspected an ectopic. Okay, by the 7 weeks, the scan should show the presence of a fetus with a pulsation, right? So the pregnancy test is positive and the ultrasound scan show an empty uterus. Yes, the mass is not seen, okay? However, the most likely diagnosis or the suspected
Yes.
diagnosis is the ectopic, okay? So this is what you need to tell her, okay? So her pulse is 90 beats per minute, and her blood pressure, as we said, it's going toward a little bit to the hypotension side. Her hemoglobin is stable and 11, and she had O negative blood group. She believes that you believe that she needs a laparoscopy. Okay, so such a decision, I was happy when you involved the consultant and you said that you are going to involve the consultant in such decision. Of course, this is not a case where you uh, you know, manage by yourself, okay? You must include your senior here. Explain the suspected diagnosis. So he made it clear for you that this is the suspected diagnosis, okay? And he made it clear for you that you need to explain the diagnosis and the proposed management for her, okay? So your task is to explain the diagnosis, discuss management, and answer the patient concern. However, okay, you will need to take some history, and we said the information gathering is there. So that's mean, what is the most important element in the history taking?
Her current situation, pregnancy
Current
history.
situation, yes, current situation. So I don't need to go very much, back in her history and dig down, okay? So for example, what do you think if the patient is drinking alcohol? Would it make a difference here today? Of course, it's illegal under the 18 years, but anyway, would it make a difference in your decision making? That's why the examiner didn't ask you to take the history, but he will depend on you in your management when you explain the management plan that you will cover the necessity point, especially also that you have patient safety module here, okay? Domain is here. So unwell patient, what is the approach to unwell patient? Approach to unwell patient is very much different to a patient who is in the clinic, come for booking, for example, right? So if the patient is unwell, the first thing and the most important thing is the immediate
Resuscitation.
well-being. Yes, so you check her immediate well-being, as you said at the beginning, okay? So how are you doing at the moment? So approach to the case, as I said again, and I will always say, this exam is obstetrician got talent exam, okay? really. So you just imagine yourself now in the early pregnancy assessment unit. You are on call doctor and you've been called to see Angelina Jones. So when you come to see her, okay, you come sensitive, of course, because you know already the background of the case and you know the name. So address her by the name, please. And hello, is it Angelina Jones? Yes, so I'm Dr. Sajida, one of the doctors on call today. May I confirm your date of birth or your age, please? So she will tell you.
Okay.
Okay, so sorry, Angelina, how are you doing at the moment? Okay, so how are you doing at the moment, or how are you feeling at the moment? Okay, is important first question to ask a patient waiting because she was admitted, okay, to the hospital with pain, right? So how is the pain? Is it okay for you to continue? I need to ask you some question and discuss with you our management plan. Is it okay for you to continue? Are you comfortable to continue this consultation? Yes, she will tell you yes. Okay, of course. So then you come to ask her an open question. The open question, so the patient will reveal the story. What has happened? Would you please tell me what happened to you? Okay, or what brought you to the hospital today? It's the same thing. It's an open question, letting the patient tell you the story. Okay, so the patient will tell you the story that I have this pain, I have this vaginal spotting, this is have been there for the last 24 hours, but it gets worse recently. That's why I came, okay, to the hospital. And you as you can see here, okay, that she had pregnancy test positive. Okay, so ask her if she's if she aware that her pregnancy test is positive. Okay,
Okay.
if she's aware, then it's okay. Okay, so let's come to the other question that you think it's important. Okay, so Angelina, would you please tell me, do you have any medical problem? Are you under any treatment? Specific treatment, because this will make a huge difference in your management, right? Okay, it's a safety here.
Yeah.
So do you have allergy from anything? Okay, have you been undergone any surgery before? Okay, so and Gina, I can see that you are here by yourself. This is when you check. Okay, and do you want me to call your partner? Okay, or call your parent or somebody to be with you? Okay, so here she will tell you that I don't want to. Okay, so she will tell you something, of course. Usually the role player will have such a story to tell you. Okay, so she will tell you, no, I'm living with my mom, she is working or something like that, and I'm afraid she will be angry to know something like that because she doesn't know. Okay, so she didn't reveal that her parent doesn't know about this. Ask directly. Okay, ask about her partner. Okay, is your partner aware that you are here? Is your parent aware that you are here? Okay, why we are asking this? Because we want to know, okay, if she's in a regular relationship or if she had a boyfriend, regular partner, okay, or this was a result of assault, we don't know, right? So she will tell you. You ask her also about the parent, so she will tell you that she doesn't want her parent to be aware. Okay, so then you just say, of course, I understand this, and stop here. Okay, stop here. Why? I need to discuss with you, Angelina, the report or the ultrasound report and what is we think that you have today. Okay, so the ultrasound report show that along with the pregnancy test is positive, ultrasound report show that you have an empty uterus, and by 7 weeks, okay, you missed your period. Okay, and if your period is regular, that's mean we are expecting to see a baby today. With you having this severe pain in the tummy, along with the scan and along with the test, this makes us think that most probably you have pregnancy outside the womb. However, you just say that, okay? However, okay, we might find other causes for that. That's why I need to inform my consultant to have a look at you, okay, and to check the examine you, okay, and to confirm this. So are you aware what the pregnancy outside the womb or the ectopic is? Why I'm asking this patient, the 16 years old, so many questions about her understanding, because we don't expect that she understands everything. She's only 16, okay? So
Yes.
she's, and you are checking the capacity by this. So she will say, yes, I have studied this in the science or in the biology classes, and I understand what is this pregnancy, the ectopic pregnancy. So is it, so you explain to her the implication of that and how serious is it, especially that she have the pain already, okay? And she is not that much well, so we think that this may rupture, and in this case, it can be very serious, okay, and lead to bleeding inside the tummy. Okay, and we need to do an operation for this. Okay, so the operation would be by the keyhole surgery. Okay, and this is while you are asleep. Okay, when we will go with a camera, you know, a telescope, and along with the camera inside your tummy, and we have a look and check both ovaries and the tubes and your womb. Okay, and you say about the pregnancy, if we found this pregnancy outside the womb, then it will be removed. Okay, and this means also sometimes we can remove it alone or remove it along with the tubes. Okay, this is a surgery, and it's every surgery had a side effect or a complication that can happen. This might include pain, some frequent problems like pain, bruising, or a hospital stay for 2 days after this, okay, or infection that can happen after following the surgery. Or this can be serious, especially if we found that this ectopic is ruptured inside your tummy, okay. And the serious problem could be injury to the other organ or injury to a blood vessel that require that lead to severe bleeding or so much bleeding, and that means we need a blood transfusion. Okay, so do you have any reservation for blood transfusion? So why I'm asking this question, he said that she is Jehovah's Witness, but not all the Jehovah's Witness are having a problem with the blood transfusion. Some of them, okay, not very religious, and they can accept. Of course, she will say something like, no, I don't want, or we don't believe in the blood transfusion. Okay, so then you tell her, I'm so sorry, I understand, I do really respect your beliefs, okay, but in serious situation, when your life, we will take all the measures and we will try not to give you a blood transfusion, but sometimes the blood transfusion can be the only thing that saves your life. Okay, and since you are under 18, since you are a minor, okay, so I'm so sorry that you are not able to take this decision for yourself. Okay, the consultant will act in your best interest to save your life. Okay,
Yes.
so just tell her that this is what happened. After you express your respect to her belief, okay, and after you say that you are going to take all the measures to, you know, not to reach to this status or not reach to the point of blood transfusion, but because sometimes this is the only way, then the consultant will do this to save your life in your best interest. Okay, so regarding the parent and their awareness, okay, so you need to check the parent, okay, and their presence. Why? Because again, since this is, as I explained now to you, you can see this is a major operation that we are expecting here, that you will go through it, and we don't want to delay this. Otherwise, if there's an ectopic, if it's confirmed to be an ectopic, this risk of the rupture, as I told you, and in this case, the operation will be an open cut operation, okay, through your tummy. So in such situation, I think that you might need to tell your parent about it, okay, and they can, of course, they can understand and help you and support you in this difficult situation. If she said, I don't know how to tell my mother, okay, then you tell her that I can explain that to her. Okay, so what do you think? Do you want me to call? Okay, because I'm so sorry, your confidentiality will be maintained unless you are in danger. In this case, we have to breach your confidentiality. So if the things gone into a wrong way, then in this case, we will need to inform your parents. So do you want me to call them for you now? Or do you want to think about it? Okay, so if she said, if you approach in the right way, most likely the patient will agree. Anyway, it's an operation and she will stay in a hospital and for 2 days and things might go wrong and blah, blah, blah. Okay, so that's mean this situation is big for her. Okay, and you are also offering to help, that you explain to the parent on her behalf. Okay, so this will make her understand. But if we started by saying, I'm so sorry, I will inform your parent or I will breach your confidentiality, she will resist you.
Yeah, I started with the conflict about the
Yes.
blood and
So,
parents. I started with the conflict that was the wrong. So when
so
I come to this stage, then stepwise I have to. Okay.
yes, stepwise, and make sure that you have enough time to reach to this
Yes.
point. That's why
Yes.
I wouldn't waste time in the history taking, for example, because it's not even required. Okay. It's not even required. So you just ask her some questions about, very important question, ask her about she had medical conditions or not. Maybe she's diabetic and she needs insulin now. Okay, we don't know. So we will need to ask this question, okay, in the beginning, after you check the immediate well-being of the patient. Okay, so checking the immediate well-being of the patient, ask about the current situation, okay, and then explain what is the diagnosis and explain that this is a suspected diagnosis and that your consultant will be involved in the in the decision making for this patient. And you come to the point of if she wants you to call her parent or call her partner, okay, if she had a regular one, of course. So these things will come in that sequence, okay? Because the conflict will be the last thing to discuss. If the patient trusted you from the beginning and you were okay from the beginning and supportive and at the end advised her to inform her parent, most probably she will listen to you.
Okay.
Okay, but after you give her the correct information. Okay.
Okay, yes, thank you so very much.
Okay, thank you. So guys, any questions so far?
Ma'am,
Yes,
shall I
please.
ask, ma'am? Ma'am,
Yes, sure.
anti-D, ma'am. And
Yes.
yes, ma'am. And one more thing, ma'am. Ma'am, any place for intraoperative cell salvage, ma'am?
Yes, of course. That's why
Okay,
we
ma'am.
will tell her this,
Okay, ma'am.
that you will be in a safe hand, and a specialist or senior doctors will be with you in the theater.
Yes.
We will take all the measures to
Okay,
prevent that, the blood loss and prevent the blood transfusion. But however,
yes.
sometimes this is can be the only way to
Okay.
save your life. So if it is the only way to save her life, so
Okay.
in this case, she's under 18, so the blood transfusion will be guaranteed,
Okay.
will be given
Thank
to
you,
her.
ma'am.
You're welcome,
Thank you,
dear.
ma'am.
Another easy task. Anybody would like
Ma'am,
to present?
coming till end, we forget usually anti-D. So how to incorporate it that we don't miss it?
Yes, it's in the post-operative. Okay, the post-operative, you just tell her that after you finish the operation, okay, you will be transferred to the ward, okay, and you will be given fluids and an injection. Okay, this is the anti-D. However, I didn't put, okay, much, marks on this part, okay, because it's not the core of the station.
Okay. Mhm.
You know that in every domain there will be some point, those point that's the important point, and this will be marked, okay, and for the examiners, if the role player, sorry, if the candidate missed one of these, this will change the marks from pass in the domain to borderline, and if they miss 2 points, okay, of these highlighted ones, then that's mean it will be a fail in this domain, in
Okay.
this station, no matter how many things you said. Because if you said 8 things, okay, out of 10, and under this domain, okay, for this station, there's 2 things and you missed, and those 2 things was the highlighted lines that you should never miss. Unfortunately, you still fail the domain.
Okay. And we
Okay.
can miss VTE mention. We can miss. That's not that important here. Of course, it's in surgical module. It's
This
very
is in the,
important. So
yes, in the surgical module, we have to inform her about the, you will have measures to reduce the risk of the blood clots. Okay, this is when you discuss the consent in detail. So usually if I discuss operation, okay, and what's happening in this operation, I will ensure first that I have proper history and ensure that the patient have proper understanding and she accept any extra procedures that could be done, okay, and the risk as well explained to her. And I will explain to her what is the procedure and what is included and the steps and the post-operative what will happen. This detail in the surgical module when we have to discuss an operation. This main station, main mark on the counseling, and the safeguarding issue rather than the ectopic and its management issue. Okay.
okay.
So it's sometimes you can't cover everything in the details, okay, as equal, because this station is designed for that. That's why he put the age factor, the age thing. Okay, so the age makes the very big difference. Being a Jehovah's Witness makes the very big difference. Okay, so that's mean he is guiding you towards what to cover and what to say most probably. So if you just cover this case as a case of ectopic pregnancy only alone, you think that you will pass?
No, not at all.
No, not at all, right? Because the heavy marks on this station are towards the safeguarding and towards the counseling. Okay.
Thank you so very much, Dr. Ba. Thank you
You
so
are
very much.
welcome. You're welcome, dear. Okay, so yes, Dr. Tasrina, she want to have the next. Okay, come on, Dr. Tasrina.
Assalamu alaikum, Dr. Rabba.
Alaikum salam. How are you, dear?
Yeah, Alhamdulillah.
Such an easy recall again.
Okay.
Okay, so Dr. Tasrina, you might need to start now.
Yeah, okay. No. Should I start now?
Yes, please.
Hi, I'm Dr. Tastrina, one of the doctor in this early pregnancy assessment unit. May I confirm your name and age, please?
Yeah, hello, this is Jeanette Davis, and I am 24 years.
Okay. Is it okay if I call you Janet?
Yes,
Thank you, Janet. Janet, I can see that you are here because you were pregnant and you had an ultrasound scan, right?
yes, correct.
Yeah, Janet, may I ask you some question to know more about you? Then we can discuss about your management plan.
Yes, sure, doctor.
Okay, can you tell me more about this pregnancy?
Yeah, doctor, this is my second pregnancy, and I think I missed my period 9 weeks ago, and everything was okay apart from having some
Mm,
more vomiting than usual. But
okay,
I started to have some bleeding 3 days ago, and today I passed some tissue which is purple in color. So I become very worried and anxious actually. That's why I came to the hospital to have the scan.
okay. Do you have any tummy pain now?
Not much really.
Okay, is it your first pregnancy?
No, this is a second.
And how was the first pregnancy?
It was fine. I have a 3-year-old child and all are good.
Okay, how was the mode of delivery?
It was normal.
Okay, okay. And so your last period was 9 weeks ago, right?
Yes, it is.
Do you have any other medical condition?
No, I don't have.
Okay. Are you taking any medicine regularly?
Um, no, I'm not taking only folic acid.
Okay. And any previous surgery in the down below or in the neck of the womb?
No, I don't
Okay. Are you aware of your blood group, Janet?
have. I think it's A positive.
Okay, Janet. And how is the support at your home?
It's fine, doctor. I'm living with my partner and all are good.
And in the past few months, have you ever felt any down, depressed, or hopeless?
No, I'm just fine.
Okay, Janet. Thank you for all the information. Would you like to add anything else?
No, thank you.
Okay, Janet. I can see that you are alone here today. Would you like to have someone beside you?
Uh, no, doctor, I'm fine. Please tell me what is wrong there.
Janet, I have difficult news to share.
Oh,
Unfortunately, we don't have any good news to share with you now. And the scan, uh, would you like to continue or
yes, please tell me what's wrong.
okay. The scan is showing that actually there is no baby inside the womb. In spite of that, there is
What?
some,
What you've
uh,
said? No, baby. How? I'm
yeah,
pregnant, I'm sure.
yeah, but sometimes there can be some abnormal pregnancy,
Hmm.
and we
Hani
call it
Rashida Bunduga.
smaller pregnancy. Have you ever heard about that, Janet?
No, I don't understand what it is.
Okay, sometimes about the with the baby there is a afterbirth. Sometimes there are some abnormality in the pregnancy where there is our body is made up of lots of cells where there are some chromosome, and we get half of the chromosome from our father and half from the mother. Sometimes there is no chromosome from the mother, and in that time there are some abnormal pregnancy which cannot produce a normal baby, and
Okay.
it we call it molar pregnancy. So
So,
now,
do you
yeah,
mean that? Do you mean that I have just lost it?
yeah, so as there is no baby, so we have to uh, evacuate the product from your evacuate the
Product? What
sorry
what product?
yeah, there is some abnormal growth of the after birth, so we have to remove this from inside the womb.
Okay, so why just wait till it come out by itself?
Well, as you have already started bleeding, so we have to manage it with some procedure. Shall I describe about the procedure? Would you like to know?
Yes, I would like to know what are you going to do? If there's any treatment that I need or just leave it as it is.
Yeah, you know, this molar pregnancy, we are really aware of because it can sometimes, if it not treated on time, it can produce some bad effect on the mother. And also now we need to admit you first. Then we, after taking your proper consent, what we are going to do, we have to remove uh, uh, the afterbirth from your uh, womb. For that, we'll take your consent properly, and then we may we'll do some investigation in your blood. We'll check your pregnancy hormone. We'll check how your liver and kidney are functioning, and we'll check your blood to see how is the hemoglobin or the blood concentration is. After that, we'll arrange some blood for you. Then after maintaining some safety checklist, we'll do the procedure for you, and my our senior consultant will do the procedure under ultrasound guidance, and will not give any medication for uh, softening the neck of the womb if possible. And after the procedure, we will send the product or the thing that will come out for histopathology. And
What are you
after the,
saying? I'm sorry, I didn't get you. I didn't get what you're saying. What is you're sending to some?
yeah, the tissue which is inside the womb, we'll send it for more examination under the microscope to see the condition there, because
Okay.
it is a you know, it's not a cancer, but sometimes it can produce some cancer, so we have to have a regular follow-up, and we have to check the material under microscope to see that whether there is any cancer or not.
Cancer.
We have to confirm the
Am I ha
diagnosis.
am I having a cancer?
No, that's not a cancer, but it can progress to cancer, so we have to confirm the diagnosis.
How? I'm sorry. How this can be? Now I got confused now. How this
uh,
can be a cancer? This is just a pregnancy.
yeah,
And
Janet,
you're just telling me that there was no baby.
yeah, it's just an abnormal pregnancy, but and we have to confirm it again that it is an abnormal pregnancy.
What is the meaning of this? I think I'm now feeling puzzled.
Yeah, after doing the after the procedure, uh, we'll give you some medication, and we'll connect you to the there is a there are some regional center for this disease. They will keep they will maintain your follow up, and we'll follow up you with your
Am
pregnancy
I
hormone.
am I having a disease? Is it something serious, doctor?
Oh, it's not serious now, but if the proper follow up is not done, it can become a serious condition.
Okay.
So we are going to monitor your hormone level in each week, and by this time you have to maintain a proper contraceptive. We usually advise patient to maintain the to use the barrier method. And if your hormone level comes to normal within 8 weeks of the procedure or surgery, we'll follow up you for 6 months from the date of surgery. And if it takes more than 8 weeks, then we have to follow up you for 6 months from the date of normal report. Okay. And I know these are lots of information. We are going to admit you, and we are going to take your proper consent. then I will give you the
But
proper patient
no,
information.
I can't be admitted now. I just left my kid with the childminder, so I need to go to bring my baby. And
Okay. Okay, if you want to go, please don't delay, because there can be excessive bleeding at any time. So if you notice any excessive bleeding or excessive tummy
no,
pain, please do come to us without any delay. And
it's your time, Dr. Tasrina.
yeah, thank you.
Thank you very much. Thank you. Okay, so what do you think?
The management was not good, and I use some jargons.
Okay, so
And
I'll ask you as you are doing reflection on yourself. Okay, so in the
yeah,
reflection we learn from you know, our actions, right? So we
yeah,
reflect also on the good things and on the things that could be better, right?
yeah.
So tell me, what are the good things you think, and what are the things that you think it's better to do it in a different way next time?
While describing the diagnosis, I had to tell that it's pre-malignant condition, and at that point, I had to say about all the pros, about the risk, if about the molar pregnancy.
Yes, yes, I
Yeah,
agree, because the patient need to understand that this abnormal pregnancy is not just like any miscarriage, but
yeah,
this can turn into something sinister, okay?
mm,
And this can grow or tend to grow and to invade other tissue, okay?
mm,
So that's mean we need to monitor you for
yeah,
that. And there is also some test that you'd like to do at the moment, my dear. Okay,
mm,
so when you are going to manage a case of molar pregnancy, you have to run some workup before you
mm,
decide to manage this patient by the suction, right? So for
yeah,
example, okay, and it's also something that you missed in the information gathering. For example,
mm,
what do you think from the investigation that's very important to this patient?
mm. From the investigation.
Yes. Any test that you're going, any scan you will do, especially to the lungs?
Oh, chest X-ray. Yeah.
Okay, just X-ray. Anything
Mm.
else? Any tests that you will run? Any blood tests from here or there?
I said the full blood count, liver function test, renal function test,
Okay.
and beta HCG.
Okay, so the hormone level, you mean? Okay.
Yeah, and I could do the thyroid profile also.
Okay. Anyway, so okay. So let me reflect. Anything else you would like to do in the reflection? So I will.
Mm. I think these are all only the diagnosis should be more clarified to the patient.
Okay. So you will discuss about the diagnosis and the implication of diagnosis further.
Yeah.
Okay. Anything else?
Uh,
Anything about the treatment of this patient?
um, the suction evacuation and follow up.
Okay. So in some cases, if this is only a molar pregnancy, so it will be a suction evacuation and follow up. What about
Yeah.
if you discovered that this is already invade other tissue and it turned into a GTN?
Then the chemotherapy.
So the patient need to be aware, right? The patient need to
Yeah.
be aware that there is other options of the treatment or other possibilities of the treatment. That will be according to the tests that you run,
Yeah.
right? Okay,
Mm.
so coming to your specific feedback, my dear. Okay,
Mm.
so Dr. Tasrina, I'm sure there is no problem in the knowledge. Again, which thing that I'm sure of that you are up to the standard of this exam from the knowledge, base. But I would say something about when you approach a case again, because
Yeah.
it's a pregnancy complication. This module called early pregnancy complication, right? So the
Yeah.
complications and is always coming to the early pregnancy unit, for example, okay, and you need to either take the decision to admit the patient or to send the patient home with a plan to follow up or whatever. Okay, so this is regarding the what do we expect. So that's why we have a lot of station with breaking bad news or with a plan for a follow-up and blah, blah, blah. The patient here, she came with vaginal bleeding and pus of tissue, which is a grade-like, okay? So in her story, she told you already that she had in her second pregnancy. You have asked about the onset of the bleeding, okay, but I would like you to elaborate more about this type of bleeding that she have and if she had any other symptoms, okay, like related to the molar pregnancy, because you have the scan and you know that this is molar, right? So ask her about bleeding, pain, any problems with the waterwork, any problem with the bowel movement, any cough, any headache, okay? And, these things like feeling of dizziness or all, okay, need to be asked to this patient. To the cough and headache, they will be waiting for it, okay? Because usually the metastases of the GTN go to the lung and brain, okay? So if the patient feel any abnormal, lump in her tummy, okay, and if you ask her, actually she will tell you that she feel that this pregnancy is bigger than the previous one. She think that she had a twin, okay, because it's growing faster. Anyway, then yes, you continue some basic information about this patient and then come to the explanation. It's explanation as breaking bad news. In the breaking bad news, I need you to have some practice on the breaking bad news, so to be more, smooth than this. So first signpost, second signpost, and you say the diagnosis. After you say the diagnosis, leaves the patient to absorb the news. Okay, that's mean a pause, and then break this silence by asking her, I'm so sorry. They're saying that I'm so sorry. It must came as a shock for you. Okay, do you want me to continue? Okay, or do you have any questions for me? So, but I need you again to show your empathy and show your sympathy as well to the patient in your tone, on your body language, okay? Because the breaking bad news, somebody else will be there watching you, okay, and assessing your communication. Okay, so please, in the breaking bad news, give it like 1 or 2 minutes appropriate, okay? So everybody will do it at their own way, okay? But make sure that your acting is very well, okay? So this is one thing. Another thing is you come to the explanation of the molar pregnancy, okay? So it's it's abnormal form of pregnancy, and you have explained it since the meeting of the gametes, okay, which is okay, but what they will be waiting for you, okay, that your language should be very clear, okay, that the patient must understand what are you saying to her, and you answer her questions, okay. So I would suggest that everybody revise for this topic the patient information leaflet, and I can say that you have read the patient information leaflet and you are using some lines from it, okay. But again, look to the questions here. So here is the explanation of the molar pregnancy, okay. So of course we'll not say we'll say that this is abnormal form of pregnancy, and let me explain to you what happened in normal pregnancy. So for a fetus to develop, okay, they need 1 sperm fertilize 1 egg, and there will be a chromosome from each that will combine. The baby will have 2 sets of chromosomes, one from the parent, father, and one from the mother. And then what happened in the case of molar pregnancy, this will be most commonly fertilization, or a sperm meet an empty ovum, right? So result in abnormal pregnancy, which we call it the molar. Okay, so this pregnancy unfortunately will fail to develop into a healthy baby. Okay, but the problem with this type of pregnancy is that it has a tendency to invade other tissue or go to other tissue, okay, and can turn into something sinister. Okay, and in this case will need further treatment as we treat a tumor. Okay, but the only way that we can confirm a molar pregnancy is to send, and here, okay, I would advise you not to use the word product at all in this exam. Okay, patient think that product, when you say product on a pregnancy, is a rude word. Okay, especially if you have a UK role player in the exam. Okay, so it's rude for them, so please don't say it. Just say the pregnancy tissue. Okay, so this pregnancy tissue need to be sent to a specialist lab. Okay, so they look, a specialist doctor will look under the microscope, okay, to see this tissue and the behavior. And also we are going to run some tests, okay, further test for you. This will be a test for your x-ray, okay, for your lungs, okay, and we are going to run some blood tests to see how is your blood count and how other system work, like the kidney and the liver. And also we are going to check the pregnancy hormone, because in the future it's very important that we follow up this pregnancy to ensure that the pregnancy hormone fall till the normal level. Okay,
Yeah.
so the proposed management that we do in this case will be the surgical through a small procedure, okay, where the consultant, okay, or a specialist or a senior, use whatever you want to use, okay, is going to have, while you are awake, okay, with just some painkiller or numbness, okay, from down below, will have a suction-like tube, okay, that's to get this tissue and to clean the womb. You didn't need to say anything about medication. This is very technical, okay, and you know that we can use oxytocins there in cases of severe bleeding, but this is will not say it to the patient, okay. This procedure is a simple procedure, however, it has some risk. Okay, that's because of that tissue and this grape-like tissue that's the same like you passed. Okay, the womb can be very soft. Okay, and make it very liable to injury. Okay, and so we will be very careful in doing that. And if any complication that can happen, that we should be ready to treat it. So also we expect in some cases, we expect a severe bleeding, okay, that might necessitate a blood transfusion. So do you have any conservation for blood transfusion? So the patient will tell you yes or no based on that. Okay, so after that, as I told you, you should recover quick if there's no complication, okay, and you can go home next day. And the report you will be contacted by the report of the molar of that tissue, result. And also we'll advise you that you stay in contact, okay, in a close contact with the hospital in case if there is any excessive bleeding, foul smelling, or any abnormal feeling, like feeling dizziness or severe headache or chest, okay, having a cough or any change in your condition. Also, your GP is going to work in close contact with a specialist center. They will be aware about you, okay, and you will be asked to have the follow-up. You have said the follow-up very well, okay, so the follow-up by taking the urine sample, and sometimes they can take blood as well. Okay, that's very important to ensure that the hormonal level is reducing. Okay, in the same time, we will advise you that you should have a reliable form of a contraception. The barrier method is a good option, but also according to the FSRH update, their hormonal method can be used in the cases of molar pregnancy. Okay, so you have explained the follow-up and the 6 months if the result came, during the 8 weeks to the normal, or if it takes longer than this, then this will be 6 months from the day of the normalization. And after you finish your follow-up, then you might need, you might think about having another baby. In this case, it will be safe for you to stop the contraception, but not before that. Okay. So the patient will need, of course, the patient information leaflet, and need from you that you write back to her GP, inform her GP. Of course, she will stay in the hospital today, but consultant also will be aware. Okay, and if the patient asked you that she can go home because she has another child and she want to arrange for child care or somebody to take care of him, of course, yes, as you said, the safety netting is very important. So that you tell the patient that she's at risk of bleeding, so she need to have a 24-hour contact number, and she need to have somebody to bring her to the hospital, okay, immediately in case if she had any severe bleeding or any problem. Okay, and also before she go, the consultant must be aware of this, that she is going home. Okay, dear. So thank you very much, Dr. Tasrina, for your presentation.
Thank you.
You are welcome. Okay, so our last presenter today is, I'll just check the chat. Okay, so I think that Dr. Deepa, she presented last time. So Dr. Deepa, dear, we'll see if anybody new who didn't present last time want to present. Okay, what do you think? Okay, so Dr. Noha, she said that she want to present as well. Okay, so in order to be fair, I'm trying, okay, to give everybody equal chances, guys. Okay, so okay, so we have Dr. Noha and we have Dr. Aya, but one of you will present today and one of you shall wait, okay, to the next session, please. What do you think? Okay, Dr. Tripti, you will do next session. Thank you. Okay, so Dr. Noha and Dr. Aya, which one is going for February exam? Tell me, please. Hello. Okay, so Dr. Noha is going, and also Dr. Aya. Okay.
Kando?
Hello, Dr. Hamida. So Dr. Hamida, it's, you know, it's by who express the, you know, their wishes for presentation first. So I'll tell you now, we have Dr. Noha and we have Dr. Aya, okay, because they both thinned in the same time and they are both going for February. Then we have Dr. Tripti,
Okay, no problem, I can.
and you. You're welcome. Okay, Dr. Hamida. Okay, so next time that will be Dr. Tripti and Dr. Hamida. Today we have Dr. Noha. Would like to present? Okay, and Dr. Aya next time. Thank you, everyone. Thank
It's
you.
okay.
Okay, so
No,
come on,
no.
Dr. Noha, please tell me.
Okay, thank you.
Hello, my dear friends. Can everybody see the screen?
Yes.
Okay, so Dr. Noha, she can see the screen. Please, Dr. Tripti, try to refresh or log out and log into the meeting again. Thank you. Yes, Dr. Aya, inshallah, you can do next session. Okay, so Dr. Noha, when you are ready, please let me know so I can start your
Okay.
timer.
Yes, I'm ready.
Okay, that's good. Second.
Start.
Okay, 1 second.
Should I start?
Yes, please.
Yes. Hello, I'm Dr. Noah, one of the doctors in the clinic today. May I confirm your name and age, please?
Hello, doctor. Yeah, this is Sarah Jones and I'm 21 years.
Okay. How do you want me to address you?
Sarah is fine, doctor.
Sarah, I've gathered from your notes that now you are pregnant and you had done some investigations and a scan. Am I right?
Yes, correct.
Okay. So Sarah, as this is my first time to meet you, I want to ask you some questions to know more about you. And then I will tell you, do you know about the result of the scan and the investigations?
No, I just waiting for you to tell me, doctor.
Okay, so I will tell you in few minutes, and I will discuss with you also the management plan to have a safe and acceptable management plan for you. Okay?
Okay. Yeah, it's fine.
So Sarah, tell me about when was your last period?
I think this was 5 weeks ago.
And was your periods regular?
Yeah.
Did you have any pain with the periods?
Yes, usually I have pain with my period, but it's okay. I take some painkiller and it's fine.
Okay, and was it a spontaneous pregnancy?
Yes, it is.
Is it planned?
No.
Okay, and what kind of contraception you were taking?
You know, I'm not in a regular relation, but sometimes from now and then I see one of my friends. And usually if this happens, we use a condom, but this time I forgot.
Oh, okay, Sarah. Okay, Sarah, and sorry, I will ask you some questions that may look intrusive for you, but it will help in the management plan. Can I proceed?
Yes, sure.
Okay. So, Sarah, how many partners do you have?
No, I'm not having partners, but you know, sometimes I got somebody I like, and we chat together. Something, you know, something led to the other, and that's what happened.
Okay, and have you ever been treated from any sexual shedded disease?
No,
Mhm. Okay, and what is your job?
I'm a student. I'm still in a college.
Okay, okay, Sarah. Sarah, did you have? Are you following up with your cervical screening program?
No, I didn't know I should do this.
Oh, sorry. You are 21. Sorry. Okay. Are you? Did you take the vaccine for the human papilloma virus?
Yes,
Okay. Did you have any surgery through your tummy or down below?
no,
Apart me from asking, have you ever been pregnant before?
no,
Okay. Do you have any medical disease that you visit your GP regularly?
no,
And do you have any known allergy?
no,
Do you smoke?
no, I'm not smoker.
Do you take alcohol?
Socially only.
Apart me from asking, any recreational drugs?
No,
Okay. Do you know about your weight to height ratio?
yes, 20.
Do you know your blood group?
Uh, no, I don't know.
Okay. Who are you living with?
I'm living with my roommate, and because I'm in a college, I'm away from my family.
Okay. And what do you do for a living?
I am a student.
So your family is supporting you?
Yes, sure.
Okay. And how is support at home? Do you feel you need support at home?
No, I'm fine.
Okay. Okay. Thank you for sharing this information with me, Sarah. Is there anything else you want to add?
No, thank you.
Okay. So Sarah, coming to the results. According to the your pregnancy hormone level, it's coming back and it shows that it is 1,100, which is corresponding with your last menstrual period of 5 week pregnancy. Okay, the scan, it shows that the pregnancy uh, uh, is not seen until now. There is no
Okay.
pregnancy seen inside the womb or outside the womb. In
And
this
what does
case,
this
we
mean?
call it. Sorry, what?
Yeah, I'm just asking, what does this mean?
This means that it is pregnancy of unknown location. Still, we don't know where is the location of this pregnancy.
Okay.
Okay. To trying to know where is the pregnancy, we can repeat this hormone level again after 48 hours from the first one. When was the first one?
It's today.
It was today. Okay, so we will repeat it after 48 hours. Okay,
Okay.
we want you to come again and to check for it. We'll check the level. If the level is going up and it is rising for more than the double, this means that this pregnancy mostly inside the womb. Okay, if the level is rising but it is not more than the double, this means that there is a risk that the pregnancy is outside the womb, which we call an ectopic pregnancy. Okay. The other possibility that the level may go down. So if it is decreasing by more than by the double, this means that the pregnancy had been ended and that the pregnancy is out, which we call miscarriage.
Okay, so
Okay.
actually, I don't want this pregnancy.
Okay. So according to the result, according to where is the pregnancy and the possibility for this, I will tell you about how to end this pregnancy. Do you want me to tell you now?
Yes, but you said that I will do a test after 48 hours, but I have exams and I need to study for it, so I don't think I will be able to come.
Okay. Okay, I can see that this is a very difficult time for you, Sarah. So Sarah, now if we want to terminate this pregnancy, if this pregnancy is inside the womb, there is a line of treatment. If it is outside the womb, there is a totally different line of the treatment. They are not the same. So I'm afraid that we can't treat something we don't know where is it.
Okay.
Okay. Your safety and your health is our priority. So what do you think? Better to come after 48 hours and we can give you, we can communicate with the school, with your school, and in a confidentiality way to give you a sick leave.
Not about the sick leave. I don't need the sick leave. And the thing is, I'm so busy and I'm living far from the hospital, and coming to the hospital and staying, waiting, and all of this while I'm having exam will be just nonsense for me.
Okay, I can admit you to the hospital if you are living
Admission?
away.
You mean a stay in the hospital? Why would I stay in a hospital?
Just for your safety, because there are some warning signs.
Am I at risk myself?
There is some warning signs. If you had a severe bleeding from down below, or you had a severe pain in your tummy, this would be risky for you.
Okay, but I
and
don't
you are
have
living
pain.
away.
Okay. I'm not having a pain, or I don't have a bleeding at the moment.
Yes, but I'm afraid that this may happen tomorrow or
Why
in
would
the
this
day.
happen? Yes, why would this happen?
Okay, because if this pregnancy is inside the womb and it is miscarriage, the bleeding, okay, it can goes for severe bleeding, which will
No,
make your
stop.
life at
Dr.
risk.
Noha, it's better to not to continue. It's already your time finished. Okay, it's fine. Fine so far. Thank you very much. Okay. No. We don't admit any patient who is stable to the hospital. Forget about it. Okay. There is no enough
Because
bed
even if
for
she's
people.
living away,
There is no enough bed in the hospital for sick people, or there is a severe shortage in the hospitals nowadays. So nobody is admitting a stable patient to the hospital. Okay. This is no. Don't say that in the exam. Okay. And if the patient is at risk of ectopic rupture, or patient is at risk of severe bleeding that might happen at any time, we just give them a contact number. We check how far they live, and we check which hospital is near to them. Okay, because if this hospital is far, they must have an access to a near hospital. Okay, and to ensure that they have somebody around, okay, to take care of them, or to report if she went into an emergency or something. This is one thing. Another thing, What is the possibility that this patient had an ectopic pregnancy?
No, I don't know the possibility. Percentage, no.
So what is the risk of this patient?
They may go in miscarriage and ectopic may rupture. This is the risk. But if it is normal pregnancy, it's okay. We can terminate at any time before 24 weeks.
So clinically, what can you see in this patient? Does this patient have pain?
Okay, no, she's stable.
She's stable. Okay. Does this patient have risk of ectopic?
Not high risk.
Not high risk for ectopic, right? Okay. So this patient is stable, right? Okay. So what are the chances that you see something by the ultrasound in 5 weeks?
Still low, but it will depend on the beta HCG. If it is more than 60%, we will go for ultrasound after 1 week.
Yes, I just ask you because I'll tell you something there. If you have a patient 7 weeks, okay, and with let's say beta HCG 1,400, okay, which is not good for this, okay, 7 weeks time, and you didn't see something by the scan, so the possibility of the pregnancy of unknown location in this case is high, okay, but this patient in front of you can be anything, can be normal pregnancy, but still too young or too small to appear in the scan, right? This is a possibility, right? And a second possibility that this is a ectopic pregnancy, right? And you need to follow up to see if this is going into the growing pregnancy, healthy pregnancy or not, right? Or it can be pregnancy has stopped growing and after a few days she might have some bleeding, okay, and you didn't need to scare her because not all the patients who have miscarriage will have a severe bleeding, right? So we have the three possibilities in here, okay? So what is the correct management according to the evidence? The correct management, you said, okay, so after you explain to the patient what are the possibilities in her case, okay, you have the number one possibility that this is a normal growing, but it's still small, and number two, this is an ectopic, or number three, this pregnancy stopped growing and it will miscarry, right? But in order to make sure, we usually do beta HCG baseline as today and then repeat it after 48 hours. And according to the result, is either to say that this is a normal pregnancy and we, in this case, we will follow up after 1 week. Okay, this is a pathway of the pregnancy of unknown location. Okay, or failed. Okay, and if it's failed, then she will do only a urine pregnancy test in 2 weeks' time. Okay, and if it is ectopic, then in this case, we will repeat the scan. Okay, if there is a possibility that this is ectopic, right? And the scan will be repeated on day 7, okay? And here, this patient, she had already level of 100, so we will actually do the scan whenever the beta HCG reached the 1,500 especially, okay? Because this will be to say this is ectopic or this is a pregnancy of unknown location. So our patient here, my dear, she had these 3 possibilities, okay, but she wanted to terminate the pregnancy at the moment. And she is low risk of ectopic and she doesn't have symptoms of the ectopic at the moment. Do you have any idea what the NICE guidelines say about it?
About methotrexate?
For the patient said, no, NICE guideline doesn't say about the methotrexate. Methotrexate, it was a studies, okay, and it mentioned in one of the old TUG articles about the use of methotrexate, but the NICE guideline does not support the use of the methotrexate in this patient.
Okay.
So the NICE guideline, I just give you the screenshot from the NICE guideline. It's about, from the guideline itself, it's about abortion before definitive ultrasound evidence of intrauterine pregnancy. So we can say this patient, right? We can say that this patient that she is requesting abortion before definitive ultrasound evidence, right? So say what they say here, or find what they say here. They say consider abortion before there is a definitive ultrasound diagnosis of intrauterine pregnancy or even eMRCOG for women who don't have a sign or symptoms of an ectopic. Okay, so for women who are having an abortion before there is a definitive ultrasound evidence of an intrauterine pregnancy, eMRCOG, number one, explain that there is a small chance of ectopic. Number two is to explain that they may need to have a follow-up appointment to ensure the pregnancy has been terminated and to monitor the ectopic pregnancy. Okay, and to provide 24-hour emergency contact detail and advise them to get in contact immediately if they develop symptoms that could indicate an ectopic pregnancy. Okay, so here, okay, in this part of the guideline, they said that this patient might have a termination of pregnancy or abortion before ultrasound evidence of intrauterine pregnancy, right? Which is, okay, not the policy in all hospitals. So it's something that need somebody to take decision in it. Who can take the decision in this situation?
The consultant.
Yes. So if the patient insists on something that you don't think that this is a straightforward protocol, okay, or could be considered in some patient after proper counseling and proper assessment, so who will be involved? The consultant. Then in this case, you find the patient, she resists the decision. However, you tell her that the decision of the follow-up 48 hours, she said, I'm not coming. So when the patient said that she will not come or she can't come for a follow-up, this makes a high risk for you. It's a responsibility, right? Okay. So you wouldn't take this responsibility for you in the exam. You will ask her to wait for the consultant, okay, and tell her that you are going to inform the consultant, okay, and the consultant is going to meet her and review her case and examine her again, okay, and then they might, after proper counseling, might have another option, okay, that could be suitable for you. And in this case, this option might be termination of the pregnancy. The consultant might consider termination of pregnancy for you, but you must be aware that there is a risk of ectopic. It's small, but it's present, okay, and that you will need, as it's written exactly in the guideline, as you can see, my dear, okay, that you will need to have a follow-up appointment to ensure that the pregnancy has been terminated and to monitor for the ectopic pregnancy. Okay, and you need to have a 24-hour emergency contact detail, okay, and to be immediately contacting us if you have developed any symptom that could indicate an ectopic pregnancy, like you tell her some enumeration, severe pain, dizziness, shoulder tip pain, okay, or fainting attacks, okay, or severe bleeding. So the patient will need to aware about her options. However, I wouldn't advise you to take decision. Have you got my point, Dia? So tell her the correct management. Correct management, number one, is a pregnancy of unknown location, which is a straightforward management. Okay? And what happened if she's stable? Okay, so she isn't here. Hemodynamic stable and pain-free patient. So expectant management and serum beta HCG at 0 and at 48, and according to the level of the beta HCG. So we either go to the failed pregnancy, so this will be AUBT after 2 weeks, or it's normal, so that will be a TVS on day 7, or if it is increased but not proper increasement, so this will be a proper ectopic, and in this case we will repeat the TVS to ensure. Okay, so this is the 3 management options that the patient have mainly. Patient refused this management. She's not happy with this management. So involve your consultant, immediately. Even in the pregnancy of a non-location management, your consultant must be aware of this case. But here, tell her that you are going to involve the consultant, okay, about her, and she need to meet the consultant for a proper counseling, and the consultant is going to review her case and her notes and the test result, because there is another option if she want the abortion, if he think that it is safe for her to have a treatment for termination of pregnancy. Okay, so this will be by the consultant. Okay, and you should be aware these three things. Again, there is a chance of ectopic. You need to come for follow-up to ensure termination of pregnancy, or ensure that the ectopic is ruled out. Okay, and you should report to us the safety netting if you have any symptoms, enumerate the symptoms for her, and provide her with 24-hour emergency contact detail. Okay, so finishing the station by proper, counseling, tell her about what is her options, okay, and involve the consultant, okay, and the consultant will take the decision, not you. Okay, but don't go into the conflict of, no, it's not the thing that we do, no, it's not safe, no, we have to see the pregnancy first before we do anything. Okay, so don't go into a conflict with her, because there is evidence in the guideline, and that's why it's there in the NICE, okay, that there is option for this patient, but it's not on the level of recommendation. It's not your decision. This is a consultant decision only. Okay, some cases are like this in the exam, especially in the early pregnancy there. The very famous case was an ectopic that she need only medical management. However, there is risk that she had some pain and she had previous ectopic and all, and she insists on the medical management, okay, while you think that the surgical is the best for her case, for example. Okay, this case will not end by the patient choose one option and you agree for that and prepare her for that. No, this patient must end by proper counseling and let the consultant take the decision. Okay?
Okay. Okay.
You are welcome, dear. Thank you very much.
Thank you.
Thank you,
Thank
my
you very
friend, for your time today. Okay, and hopefully that you find our cases useful and interesting, okay, in your preparation. We choose the cases from this exam standard cases, and guys, you are all doing well. There is still an opportunity for improvement, so work on yourself, please. Okay, work on your point of weaknesses and improve your communication, improve your time management, and inshallah everything will go well in the exam. This exam is so simple, just take it as it is, there's rules and to be applicable, and inshallah you will all pass and we'll celebrate together. Thank you very much. Jazakumullah khair. Assalamu alaikum.
Assalamu alaikum, Dr. Abba. How to explain small cyst 3 centimeter in management?
No, it is the same thing. Okay, so this fluid-filled sac, okay, of a small size, and it's present, okay, alongside the womb. Okay, it could be just the normal pregnancy cyst, okay, which carries some nutrition to the baby, okay, or to the fetus, or it turn out afterwards to be that this is a pregnancy sac if this is an ectopic, right? So it's not something that's very significant. It is the same as the minimal fluid in the BOD. It's not significant.
Mm-hmm.
Okay.
So, or can we say we'll talk to radiologist to have some more details about cyst, its nature?
You can say that, but anyway, you are going to review this. The consultant is going to review this case from all over again.
Okay.
Okay. So most probably the consultant might repeat the scan by himself.
Okay, thank you so very much. Thank you so very much.
Okay. Yeah. Bye. Okay, so guys, just follow up on the group, okay? And I will write whenever I have a chance to discuss the recalls with you in this upcoming 10 days before your exam, okay? So I will write it there. So please just stay in touch, okay, with the group, and you choose the module, which module you like. And if you want any specific cases, I will prepare for you, okay? Thank you very much.